My name's McCrae. I'm a social worker at John Hunter Children's Hospital. I'm not a researcher, I'm a clinician, so I'll be talking today about emotional intelligence as represented by social workers and psychologists that work in diabetes, and how the psychosocial barriers and self-regulation, self-awareness, social skills and empathy all have an impact on children and adolescents' experience of diabetes, and how that sort of stuff generally gets in the way. So children and adolescents and their parents might be well educated about what to do with food, what to do with insulin, but sometimes their emotions hijack their actions with diabetes. So I guess when children can't articulate the words about how they feel, they often act out. So they might act out with tantrums or hiding or running away or refusing to do their finger pricks. And by being able to tap into that empathy, then parents can actually help engage with their kids and help find a new motivation for them to be able to address their feelings or express their emotions or understand the reasons why they are refusing to be participants in diabetes care. It's important for parents to also be emotionally intelligent as well, because without that, children don't have the appropriate role models to be able to enact all the behavioural changes that they have to do with diabetes care. Children, adolescents and parents with low emotional intelligence tend to have poor health outcomes across the board. It's not just diabetes care, it's in relation to heart disease, burns recovery, obesity recovery, and that's where a lot of the research is focused on trying to improve emotional intelligence in the health interventions, which improves compliance in treatment. So being able to have a higher level of motivation and a high level of social engagement will make the improvements to health outcomes across the board. In terms of mental health, we know that people with higher levels of emotional intelligence have lower rates of depression, have lower rates of mental health outcomes, which affect physical health and emotional health for the entire lifetime. So for children with diabetes or any chronic illness, any health condition, emotional intelligence allows them to develop the social skills to answer the question of why are you doing that finger prick without feeling shame and embarrassment, or why do you go to the doctors all the time, or why are you missing school every 3 months. So children can actually engage in that feeling normal with their peers. So in our clinic, I see all of our children and adolescents at least once a year just to do an annual psychosocial assessment, just to review what's going on in their environment, what's going on financially, what's going on socially with their peers, any transitions through school, and through that process identify whether they actually need some additional social and emotional learning throughout that year. And at the same time, I also have people who remember what we talked about when we did our annual review and ring me up saying my child's not coping, or my teenager's refusing to do their lunchtime bolus at school because they're embarrassed in front of their peers. So I'm actually able to engage with them because they know me and they know where I come from and what sort of things that we need to do to overcome the barriers to their care. So I tend to not visit schools unless there's an individual problem with a child or an individual problem with a school's adjustment to a child's diabetes. Because I guess with schools it's actually just about normalising diabetes care and encouraging supervision of diabetes care when it's needed, and when a child might not be doing it in front of their peers or might be skipping their meals because they're embarrassed about doing their insulin injection. So being able to just do that on a one-on-one basis is how I work with them. Yep. So I'm hoping to get out of a little bit more understanding of how all of the psychosocial factors impact on diabetes care, that it's not just lack of knowledge about carbohydrates, that it's not some of the new emerging research, but it's some of the underlying reasons why kids don't do their cares or their parents are unable to do their cares, is because they haven't got that connection with their child and they haven't got the positive mental health outcomes that we're really focusing on. So yeah, just largely just a greater awareness of how other health professionals can impact on that and refer to the appropriate bodies to be able to work on emotional intelligence.